Welcome everyone to the virtual world of the Eastside Freedom Library and our event tonight to introduce those of you who are not familiar with and to engage with those of you who have read the new book by Nurse T, A Pandemic Nurse's Diary, published by Tim Sheard, who is here with us this evening as well. So the basic plan is we are recording this and it will appear eventually on the Eastside Freedom Library's YouTube page. And so if you're worried about your profile and being seen, you should stay on the down low and keep your video and mic off. You can even change your name if you would like. But we will do the recording. We may or may not use the after presentation conversation depending on how that seems to go, but probably. So the plan tonight is those of you who are audience members have been muted for the duration of the presentations. And the plan is that Nurse T and Tim Sheard will speak a little bit about the book and the project that brought the book into being. And then we will hear from several individuals who have read the book in order to participate in this conversation. And those individuals are Sarah Lake, who is a retired RN, a former board member at the Minnesota Nurses Association, and a current board member at the Eastside Freedom Library. Renee Vaughan, who is a former board member at the Eastside Freedom Library and an aficionado of the musical instrument, the nickel harpa. And Renee works in a long-term care facility. And one of the reasons she is no longer on our board is that the demands of her job once the pandemic set in began to weigh too heavily on her time and energy. And it's really a treat to see Renee and to have her with us tonight. We will also be hearing from Najaha Musse, who is a medical resident about to become an MD, an East Sider, someone who grew up in Ethiopia in an Oromo community and then lived in a refugee camp and then came here to Minnesota and is going to be, I'm in line to be her first patient when she begins to have patients of her own. And we will be hearing from Mary Turner, who is the president of the Minnesota Nurses Association, and obviously an RN in her own right. So we have asked them to read the book and to prepare some comments and perhaps questions for Nurse T. So we'll start with Tim and Nurse T, then we'll hear from our reader discussants, then we'll give Nurse T an opportunity to respond if she wishes, and then we will allow all of you who have joined us this evening to ask questions or make comments. You can use the chat function in Zoom. If you are watching us via Facebook, you can use the comment function on Facebook. And then we will eventually, to foster the goal of creating community, we will unmute everybody and allow for some kind of chit chat and visiting at the end of the program. So Tim, do you want to start, or Nurse T, do you want to start? Either one of you tell us about this book. Yeah.
Yes, Tim definitely can start.
Oh, thank you, Nurse T. Let me just say a couple of things quickly. I'm a retired nurse, and when the pandemic hit into March, and I began to hear the horror stories, Nurse T got in contact with me. She has read a number of my mystery novels, and she knows me through my writing, and we've become friends. And she was telling me some stories from her experience in the ICU in a New York City hospital. And the stories were really terrifying. They were dramatic and sorrowful and scary. And so we exchanged, our ideas and our thoughts and our hopes for a few weeks. And then at one point, Nurse T, since she knows I'm a writer, she said, "Tim, when this is all over, you've got to write about what happened." And I said, "No, no, Nurse, it's your story. You write it." And since I've had the opportunity to mentor probably several hundred writers over the years through the National Writers Union, and have worked with writers, working class writers all over, we were able to meet, and I was able to help her shape her story, develop her writing, and bring her story together. So it was a wonderful experience, a wonderful collaboration that was full of respect and love between us, I think, and I think one of the most satisfying editing experiences I've ever had. So I'm enormously proud of what she did, not just as a nurse, but also as a writer too, to break into this field and to become a published writer. So perhaps Nurse T could say a little bit about the writing process. Why she agreed. Why did you agree to try this new endeavor of writing?
Yeah, it was definitely a new adventure. I want to thank everyone giving the opportunity to talk about how we did this experience. This year will be 25 years working in the ICU, and Tim and I know each other. We worked with each other for over 10 years, right, Tim? 10 years, more than that, probably. And we've always swapped stories at the bedside and discussed things together. And we wanted to, I said one day we'll be able to write this book together. And I didn't think it was going to be like this kind of a book, to be honest with you. I think being able to get in contact with him and talk about these untold experiences, what we went through during the pandemic, the peak of the pandemic, and how we were able to, everything was unknown, and working with our colleagues together and having Tim be able to put this on paper and let everyone know what we went through. And I think that was really significant. And I was really appreciate what Tim was able to work with me to do.
So can you talk a little bit about what stories first triggered this idea that you might write? What was a story that you felt you needed to tell, that you needed the world to hear about? Nurse T, what sort of story?
Yeah, I think the main thing is knowing that we work in a poor community hospital in New York. And we were already in the beginning, prior to the pandemic, we had lack of supplies, equipment was always outdated, staffing was always been an issue. So to know even hints of even an idea of a pandemic, we weren't even prepared for that. We were never really trained in a warlike condition. We put ourselves in the front line, but I just felt like Tim needed to get us to know, let everyone know what we were going through. We weren't prepared for this. Everyone was put in the front lines, inadequate staffing, inadequate supplies. And if we have all these executives who do very well and not do their part, we were doing our part. We were doing everything to save everyone's lives and save our lives at the same time and be safe. And that's the one thing I think that's how I felt like our stories need to be told, because we collaborate together. We were together as staff, looking at each other's eyes and saying, you know what, we're trained to do this, but not in this type of environment, this warlike situation. And that's why we were saying people need to know these stories. Pretty much lack of funding. There are other hospitals who have the funding, but we didn't. We weren't prepared for that.
Yeah, I know you and your colleagues were put up in a local hotel,
Yes.
You were working 12-hour shifts day after day, sometimes 4 or 5 days in a row.
Yes.
And I know you've told so many stories about just
Mm-hmm.
going to work was so difficult. I know there's a story you told me riding with a colleague, another nurse, and together, and taking an Uber ride to the hospital. And when you
Mm-hmm.
first saw the
The
roof of the
containers.
hospital, your
Yeah.
friend broke down and cried every morning.
Yes. We were lucky enough that the union was able to put us up in a local hospital. We didn't see our family for 4 months. And we were actually in the hotel with firefighters from Texas. And we were able to meet and swap some stories, but we knew we were going to go back out there. And when we were coming back to the hospital, my colleague and I mean, we saw containers. Once we opened up that car door, we could smell the bodies, the rotting bodies. I knew she just froze when she saw the building, because we were coming into COVID bombs because there was no proper ventilation. We were wearing the same PPEs for the whole 12-hour shifts. And we were like, in the beginning, our executives were telling us, it's going to be just droplet precautions. Don't wear the N95s. We know when it's something unknown, even way before this pandemic. We always prepare wearing the proper protection until we get that ruled out. It was the opposite. And I actually had an executive tell me to take it off in the beginning. And I said, no, you are going to have to take it off my face, because we don't know what we're dealing with. And that was the type of treatment we were having in the beginning, really disregarding how it's not that serious. But our patients, they were dying. We felt helpless, not knowing what type of treatment or protocol to follow. And our doctors, we had attendings who we could see it on their faces. They didn't know their answers when we asked them these questions. So knowing that kind of going back and forth for 4 months, it was traumatic for our patients to go through, for their families could only call on phones. They could not visit their family members, only through the emergency room ramps. We were just told to tell them to say goodbye because we don't know what was going to happen. I mean, that's not like what we're usually used to. We're always expecting for families to come in and visit and go through the process, the grieving process or the healing process. We never had that opportunity during the peak of the pandemic. So it was a traumatic experience, and I can imagine how it's still happening now. If you hear in India, that's what they're going through. All over parts of the world, they're going through that. But we weren't well equipped for this kind of experience.
Well, there were many, many stories that you told me, Nurse T, that were so impressive, so moving, and so inspiring. And one of the things that struck me is that the nurses went back to work day after day. They
Yes.
didn't quit. They didn't turn away. They didn't shirk their responsibility, and they didn't sign up.
Nope.
They didn't sign up for, a warlike job. They didn't sign up but they came back. Tell us about what was it that enabled or kept the nurses and the other staff, the orderlies, the housekeepers, the ward clerk, the morgue attendants, the doctors, the medical students. What is it that kept them coming back day after day, given the fear and the danger that you were facing?
We just knew, even though, everyone has a group of people that you work with and everyone has different personalities and everyone knows, but when we looked at each other's eyes and we knew that this was really scary, this is something we didn't know, we came for each other, because we knew if I'm leaving this facility from 4 crash cards still open and being used, and to come back with the same 4 in the unit, we knew we wanted to come back and help each other out, because we did not want to be left like that. So it was more like a family. At the same time, we worked with each other for years, and even with the new ones, this is just a traumatic experience you don't want to be doing on your own. And when you knew you were working with someone, you just a plastic wall next door, you want to go in and help them, because if you can get a chance to help each other, that's what would make us do it for the 12 hours, sometimes even more than 12 hours. It was just code after code, and that was really traumatic for all of us to do and to deal with. just the camaraderie and knowing, even with the respiratory therapist coming in, it was just out announcements over the PA system looking for an oxygen tank. They were just back and forth, and you could see it in their eyes, like just trying to get oxygen for everybody. And that's when we knew and found out that our system was not prepared for the oxygen capacity of the demands. And how could that be in New York? That's like unheard of. So tanks would be rolled in for us. So we had portable tanks, and it's like, this is where we expected to at least have that. And deaths could have been prevented? Yes. But in the delay of the system, and the system failed us when we were doing our best. And that's what was really shocking for all of us.
Yeah, I know that eventually the administration did offer some psychological counseling by video or by TV, which was helpful. And I know many people suffered some terrible emotional trauma from this. Tell us,
Yes.
if you would, just 1 minute, like, when did it strike you? I know you told me that I know that you were a very strong woman, right? Very
Thank you.
strong. You were just
I wouldn't have been able to
fighter.
do it. I wouldn't be able to do it without my colleagues, my coworkers, my co-nurses, my doctors that we work with. I do it together as the group, and the support that they provided for us was really, in the beginning, I didn't think we needed it. We're like, no, we're okay. But you know what, when you hear other people's stories and what they experience, you're wondering, I'm experiencing the same thing. And it was healing. And it was very nice that we were able to meet, and we would even come home and want to get back on that call to hear what everyone's stories and what they experience. And it was nice knowing what they're going through, and their families, what their families are experiencing when they know that their family member is going through this pandemic. And I didn't think it was going to be that bad. And when they talk about PTSD, it's real. And I mentioned it to you, Tim, earlier. I think saying I haven't been to church in over a year. And I felt like, okay, it's time, it's a little bit, it's not as everyone's more distancing and wearing their mask and being aware. And then actually going in back last week for the first time and hearing the music, and it just hit me. It was just flashes. I saw everyone's tattoos. I saw their blue fingers. I saw their blue lips. I could even actually smell and taste the chlorine and the disinfectant they were doing to clean the rooms. I couldn't believe, I can't believe I'm experiencing this right now. I actually had to leave and take a breath for a minute and say, this is what PTSD is, and what we went through was really traumatic. And I was talking about it with my colleagues, and it's like, and I can't believe I actually cried in church and didn't think I would go through that. But I saw the tattoos. I saw the fistulas on the arm. That's what flashed in my mind. And I'll never forget those patients coming in and just said and gave a kiss to their family member, and that was it. They didn't make it. And it's just like, it's just so traumatic.
Well, why don't we start to hear from the people who have read the book, and how the things that it makes come to their minds about their own experiences and the experiences of their colleagues. Renee, could I ask you to go first, please?
Sure. I might need a minute though after listening to all of that, Nurse T. That was really impactful, and thank you for sharing what you did and what you went through. And actually, Peter, I think I would like just a minute. Is there someone else that could go first?
Sarah Lake, how about you?
Sure, and I really appreciate your honesty, Renee. So yeah, I was totally taken by the book. So grateful, and just courageous truth tellers and questioners. I love that it started with talking about walking into a war zone and the chaotic nature of just jumbled crash carts and body bags. And I worked in a very unmanageable trauma center at one point, and so as a critical care nurse, can just really relate to so many of the facts. And I love that, I'm always struck with beginnings and endings. And I love at the end on page 120 where it says, come on, America, get your act together, wear a mask. It's so basic. And so, I loved, just immediately asking the question, what about a fan? I love the COVID bomb. I mean, not loved it, but just really cutting to the truth of, the core of the issue. Not having the long IV extensions. I did a lot of, monitoring patients and MRIs. I mean, you just can't, it's hard, to imagine, again, you're going in and you have that, sad little dirty PP, N95 for the day, but every time you open the door, that idea of a COVID bomb. And so, and the idea of managing a patient on a respirator without an IV drip, like I can't even, again, I've worked in some really bad situations, but day in, day out, this idea, and I love where you said, patients are dying of poverty. And, that really struck to the core of it. And for me, because, whether it was not having access to the remdesivir, the trial drug, the antiviral, because again, poor, and the idea that we, in this country, we make so many decisions based on, net worth. You either have a lot of money and we'll bend over backwards, or we don't care. I mean, I saw the corporatization of healthcare in 30 years, and it really made a big difference. The overtime being mandated, the patients being held in ambulances, emergency departments, the OR, the PACU. I've been in all those situations, at a trauma center, that's what happens. And, the housekeepers being laid off, because of cost cutting, and, I just did a bunch of reading to kind of, flesh out kind of the background. So, that was the foreground, and a brilliant strategy to just have a diary, day after day, what's changing, what's not changing. I was involved with the union as a shop steward, on the board, and I would tell people just write it down, because there's always like ongoing stuff. And if we don't write it down, it just becomes part of this blur. And as much of, of course, PTSD, there's no question. And yet I believe that you're committing this to paper, and I hear the strength in your voice still. It was part of your journey of healing. And that's where, one of my kind of part of what led me to retirement was I really felt like we'd lost, and I don't believe it's the nurse's fault. I have on my Bernie shirt because I feel like he was the champion, for nurses' values, for sort of saying that we have worth, that we're, we care, and no one cares about us, no one meaning administration, yeah, patients and families, they get it, and they're so grateful. They may not really understand what we do besides everything, but they get that we're trying really hard in a fragmented system that, where the primary resource, which is money, really how I see it being used is punitive. We're mean in this country. We're mean to people of color. We're mean to women. We've known this. We have so much data on these subjects, from a union standpoint, from a professional standpoint. I mean, NNU has done great work in terms of, workplace violence and unsafe staffing, and how that absolutely impacts patients' outcomes, so I just was really, and I loved what you talked about, that veteran nurses and experienced physicians have the greatest ability to control the terror, because that's, what you're talking about in terms of the PTSD is that conflict. When you walk back in there every morning to start, or every, whenever your shift starts, it's like knowing, you don't have enough weapons, you're going to battle, and you don't have the weapons, you don't have the long IV tubing, you don't have the drips for the ventilator, and the money's not there, and administration, you know, is doing their best with nothing, you know, and that's the system that we've absolutely purposely created. I believe, you know, on the one end, profit, but on the other end, you know, why don't we have Medicare for all? I've heard the arguments. It's because we don't want to level the playing field. We don't want to be decent to anyone that, you know, is worth X amount, you know, less than this amount, you know, and that is cruel, you know. And, you know, some of the stuff I've recently, and I'll finish here, you know, heard about, you know, kind of the George Floyd stuff is, you know, to be sort of just disinterested. You know, it's not even hate. It's not even like, you know, it's just like, you know, meh, you know, like, I just like, what, really? You know, like, and I think that's exactly where nursing, you know, is at. That, you know, what I tune into is that complete disinterest. And yet, you know, we can do all the bells and whistles, but people need care, you know, in their moment of need. That's what they're, you know, that's the difference. They don't know what we do, but they know when we try to, you know, communicate or just say, yeah, this is kind of a screwed up deal, you know. And, you know, that's what I think. And thank you so much for the book. I've read a lot of books and it was brilliant. It is brilliant. Thanks.
Thank
Thank you,
you.
Sarah.
Thank you.
Thank you. Renee, shall we bring it back to you?
Thank you for that moment. I needed that. One of the ways that Nurse T's book has helped me immensely is that my work environment is very different. It's long-term care. But we don't have a lot of the conversations with one another that you were talking about that are healing. So being able to read your book, and the experiences themselves weren't similar, of course, but the feelings were, and that was so helpful for me. So thank you for that. The one thing that Sarah had mentioned was the doing with nothing. And you had mentioned that too in the beginning, where it was, we had those same experiences, that not having any masks, not having anything. And when our site first had COVID infection in March of last year, the infection control would come, and it was that same experience that Nurse T had in her book, where it was sort of that gotcha kind of feeling instead of feeling helpful. And with the PPE, doing something with nothing, I had a friend that just made masks out of old bed sheets, and that's what we had between us. Our barrier was Judy's bed sheets, but that's what we did. Some of the thoughts I had on the book were that the biggest thing in the beginning of your book, Nurse T, was the ambiguous anxiety that was just constant, and it was pressure all the time, not knowing what is it I'm looking for. And I remember the Clorox. I had to Clorox everything in the place 2 times a day, and I didn't know, is this helping it? Am I just doing this for naught? We didn't know if it was droplets because we aren't nurses there. At least I'm not, I should say. There are nurses there. We didn't know when everybody on our staff just started to get sick. We didn't know, is this COVID? Is this not COVID? Is this the flu? Is it just a regular cold? And it wasn't until we finally got one resident, their son, I think it was able to get him tested. And then once we got one person tested, we were able to get everybody tested. But in fact, the state just said, assume everybody has it. We don't have any testing yet. So it was ambiguous that whole time. And that was so much anxiety there. One thing too that Sarah had talked about was a little bit about one of the frustrations that I felt quite often was when people would call us heroes or something. And I know that was always so well intentioned, but it always felt to me when they would slap hero stuff on there. Not people in the community, not the kids that made cute cards, because that was adorable. But when corporations would, that always felt a little bit like saying I had a calling to do what I was doing. And that to me feels a little bit like we're going to not pay you as much, but we're going to call you a hero, or we're going to, I lost train of thought, sorry. Yeah, I think I'll just wrap up with a little bit about what Nurse Teeth said too, is she stayed there for the group. And that was something that I experienced too, was we got to see the absolute best in my coworkers, and everybody just had to stop what you were doing, and you started to take care of people in ways that you never thought you would before, and do things you never signed up to do, but that's what you had to do during the time, and when it was widespread throughout our community. You also saw the worst in a few family members, but again, it was different because we were their caregivers, and they weren't patients to us. They lived there. So it was like all your grandpas and grandmas were sick, and you had to try and care for them, but you didn't know how. So thank you. And one more thing, thank you very much for that last part in your book, where it was about self-care and how to try to heal some of these things and different exercises. And there were so many to choose from. So if one didn't work, you could try and pick another. And that piece is very helpful to chunk off some of the past year. So thank you for thinking of that and putting that in there.
Thank you, Renee.
Thank you.
Great. Najaha, would you go next, please?
Sure. Thanks, Peter. And thank you, Nurse T and Tim, for publishing this timely work, shedding light on the everyday struggles of frontline healthcare workers during the viral pandemic. As an incoming resident physician, reading this work, I was really struck by the vivid and accurate descriptions of the hustle to save patients' lives, particularly patients who are in the intensive care units. Furthermore, one thing that I really appreciated was the frankness with which Nurse T discussed the underlying factors that disproportionately affected the African American patients and COVID-19 and their underlying conditions for cause of death. Particularly in the chapter titled Cause of Death, Nurse T writes, "In my silence, I wish that the attending physician could write in the death certificate under cause of death, hospital poverty due to refusal of the government to provide adequate resources and staff for impoverished patients of color." I mean, this speaks loud and clearly to the systemic injustice that many patients of color, particularly African Americans, face in the healthcare system. And most recently, we've seen a lot of news coverage on patients who are dying unjustly in the hospital, particularly because of these systemic injustices. So I really appreciated Nurse T's frankness with which she discussed this topic. I'm sure it's very politicized and polarized today, but really when it comes down to it, it's about humanity and it's about patients' rights. It's about protecting patients when they're most vulnerable, especially in the hospital, especially in the ICU. The reader also appreciates the compassionate care shown by ICU nurses like Nurse T. And one of the things that really struck me was how they were able to deal with delirium and patients who were really flustered when they're mechanically ventilated under without very much anesthesia or sedating medications. And the fact that the hospital was running out of these first line agents for sedation and mechanical ventilation was quite a shock to me, as that's something you see in third world countries. And so when you think about, the psychological trauma, not only for the nurses who are caring for these patients, but also the patients themselves, it begs the question, what kinds of psychiatric traumas will we see in the future? And I guess my question to all of you and to Nurse T in particular is, how can we as frontline healthcare workers, particularly primary care doctors, care for these COVID long haulers and patients who have survived the ICU stay? Thank you so much for writing this work.
Thank you. When your answer to your question, I can hopefully be able to answer that. When you're saying, what we notice is a lot of the long haulers are coming back into our ICUs. There is no particular algorithm or protocol. When we know, we ask them in the question in their interview when they come into our ICU, have you been exposed or did you experience an infection or a virus during the time of the pandemic? And they say yes. But when our physicians, when we tell them this could be chronic fatigue or symptom of them from their ongoing viral experience, they disregard it. No, the patient is negative. We're not going to go any protocol of COVID treatment, but we know they're coming back with these symptoms. And if physicians put that on their radar when they're having this response, even 90 days after the infection, they're not doing any sort of blood work to find out if they have antibodies. Is their immune response still flaring? They disregard it. And they say, well, you know, we're going to treat only their symptoms. And it's really just supportive care. And when we know there is something going on and we're not treating the underlying presentation of symptoms, and if physicians put that in their agenda as priority it's particularly the ICU. By the time their course in our ICU, they end up with multi-organ failure, and we see the path. So definitely, if they have a way of maybe doing blood draws and doing a profile on these patients, absolutely. But right now, they're disregarding it. Negative patient, we're not treating it as a COVID patient. But thank you for your question. Go ahead.
Can I just add also for Dr. Musse, there is a lot of opportunity for research for residents, graduate students, medical students, fellows, into some of these long-term effects of COVID. And, you know, many of you can make an important contribution, along with nurses joining you in the research, to documenting the experience of these patients with these long-term, long-haul COVID and the side effects and what treatments work for them. So there's room, and there's also room for nurses unions and for medical associations also to promote research and to advocate for better treatment, for psychiatric treatment and medical treatment for these long-term patients. So there's a lot of room to make a difference here, you know, but through your organizations and through your associations.
Thank you, Tim. Let me call on Mary Turner next. Speaking of unions, Mary is the president of the Minnesota Nurses Association. So Mary, want to share your thoughts with us, please?
Yes, thank you. As you say, I'm president of Minnesota Nurses Association, but I always say, more importantly, I am also a COVID ICU nurse at North Memorial Medical Center in Robbinsdale, Minnesota. And I'll be very honest with you, Nurse T. When I agreed to be on this panel, they were very kind at the East Side Freedom Library to rush it to me because I was going to read it on my vacation on the plane. But I'll tell you what, I held off doing that. And I read it the other day at 4 a.m. And it happened when I knew it would happen. I was nodding my head and crying all the way through the book because each and every page I was reliving on my floor. Now, granted, we had more resources. We at least had all of our rooms converted to negative pressure. I kept waiting in the book for you to say, yes, they finally changed all the rooms to negative pressure, and they never seemed to. And that would be my first question. Do you have the negative pressure rooms yet?
No, we don't. Still none.
Right. But I remember the very first day I came to work, that first weekend, and a young nurse running up to me and saying, Mary, did you hear we're all being given one N95 and we're told that we need to wear it till it disintegrates off of our faces. And I saw such fear in all of their eyes, and all these young nurses who would, this was not what they were taught in nursing school about isolation precautions. And the next thing she says is, Mary, how will I go home to my children in the morning? I'm afraid to go home to my children. And this is the very story that I actually told on national news, because I don't know if you guys know, but I'm on the federal COVID task force. President Biden personally, I've met him, and he personally chose me to be on this task force. And this is going to frustrate the heck out of you, Nurse T. So right now, this month, the topic is mental health issues that have arisen because of the pandemic. And I have actually had to convince people, well, what does lack of personal protective equipment have to do with the mental health of the healthcare workers? I said, you're kidding, right? And I said, do you remember the story that I said at the very first meeting, when we were all sworn in? Do you remember the story I told you about the young nurse who said, how am I going to go home because I don't feel protected? And frankly, as a labor leader, I have been on the front, not only the nurses, but I have been at multiple events, pickets and rallies and news conferences and forums of all walks of life of the frontline workers. And I've heard stories in multiple languages about how we don't feel safe and all the stress that is caused from not feeling safe at work. And the other thing is, I really had to chuckle when you cited that very first day when your infectious disease person comes and tries to tell you that it's droplet precautions. Because tomorrow we will be having our third national meeting, and in that our recommendations, and believe me, we have had to fight for it. We are going to establish that this is airborne. This is an airborne virus. And for a lot of reasons, mainly economic, nobody wants to admit that it's an airborne virus. And I remember, and I said to the group yesterday, because they're like, are you sure we can say this? And I cited your book. I'm so glad I had read it. I cited your book, and I said, because I remember you saying in there, when they told you as contact, you guys turned to this infectious disease person and said, you're kidding, right?
Yeah.
Everything in us tells us this is airborne, just like measles, tuberculosis.
Mm-hmm.
And what I personally resented, and I know I'm over time here because you know your agenda, but what I most resented through this whole time, because not only as a nurse on the floor, but being in all the conversations with the administration, I resented them coming to us time and time, treating us like we were morons, trying to convince us that because of the supply issue, that wearing a N95 for 10 whole shifts is just fine. Mm-hmm. That this is droplet, and treating us like we're idiots. That is what I resented the most. I lost all respect. I'm sorry, but I lost all respect for the CDC this past year, because it was being, that's all I'm going to say. But I thank you for, but I was doing a little bit of my own PTSD, and you are absolutely right that is a very real, it is a very real thing. In fact, I was on with one of my subcommittees, and I was listening to little Vincent. He's a student who's on the task force, and he was describing his relatives that are working in the field. And all of a sudden, I started shaking and crying. I had to turn my video off. And when I was able to come back on, I said to the fellows, I said, what you just witnessed, me on the camera here on the Zoom call, that's what I'm talking about. That's an example of PTSD that we will live with for years to come.
Mary, can I thank you so much, really from the bottom of my heart, for your honest, raw response to the book, because this is why I wanted to help Nurse T tell her story, because it not only brings us up, but it also honors you. It affirms you. You know, it
Yes.
affirms who you are and what you did. And, you know, not just the CDC, but the hospital administrators, the politicians, the corporate leaders. There's a lot of sexism, you know, and they're saying, well, you're a nurse, you don't know anything, because it's a woman's
Right.
occupation. I think that's a
Right.
big part of it. And one last thing, I think that Nurse T's, I'm really delighted that you quoted Nurse T's book in one of your meetings with some of these politicians and all.
Yeah.
I would love to get this book to senators, Congress, you know, people in power. Let them read this book and see the raw deal. Maybe it'll make an impression. But if there's any way that you know that I can get these books, I'll give them to them. You know, we're not making money. You know, we want to make an impression on them of what we did. Nurses, aides, orderlies, clerks, dietary aides, serving the food. They were at risk every day, every night.
Right.
We want to bring the story to them. So if you have any suggestions, and we'll have to be in contact afterward.
Okay. Sounds good. Thank you.
Thank you.
So I just wanted to jump in and say that I'm struck and given the kind of purpose of the Eastside Freedom Library, that we're about the production of knowledge, not just accessing knowledge from the books on our shelves, but the production of knowledge, and the idea that knowledge is produced collectively. And so the orderlies and the dietary aides and the housekeepers and the nurses' aides and the LPNs and the RNs and the doctors all have a piece of the truth. And if we can have a system where they can share that knowledge with each other and be part of a culture that encourages them to listen to each other and share that knowledge with each other, we will be on our way towards solutions and not just validating the criticisms that people have. So I think that there's something very positive in what we're hearing tonight, in how the pieces of the puzzle are held by the kind of people who are speaking with us tonight. And I want to go back to Nurse T, that you made the choice that one of the ways you were going to deal with the pieces of the puzzle that you had was by writing a book about it. And I don't know if you thought about writing a book most of your life,
No,
or how
no.
it was for you to become a writer, and how that worked for you.
Personally, I honestly think I still am not, without Tim's guidance and advice. But, you know, I didn't think this experience, honestly, really, in my lifetime, I never thought of writing a book or anything like that. But with this experience, I just know so many of us out there is feeling the same exact thing that I felt. And being able to put it on paper and let people know what we have went through and gone through, it's probably a personal healing process, but I know it's true exactly what everyone's saying. It's going to be a long, ongoing emotion that we will always be experiencing. But I'm just really happy that Tim was able to help and support me, and about the experiences that we went through. I wouldn't have been able to do it without Tim.
Thank you. And
Thank you.
thank you, Tim. So I'd like to, Carla, if you can help us open the floor so the good audience can appear and people can ask questions or make comments. And I invite you to raise your hand physically, or the mechanical raise your hand tool on Zoom. If you would like to ask a question or make a comment, we would love to get some more knowledge into the conversation.
Well, I was just thinking, Peter, that, you know, when they talked about safety, you know, it's like, I'm a big one on Maslow's hierarchy of need, you know, like I talked about, you wouldn't go to war without your weapons, you know, and it's just, you know, and even if like the basic thing is patient care, everything that we do impacts the patient and all the other coworkers who, as Tim keeps mentioning, there is no I in the world of the hospital. It's always us. And so, just on that super fundamental level, there's just something terribly wrong.
Yeah. Thank you.
I agree with you. And a lot of the times the feelings that we had is they knew all the staff, especially the nurses, had this feeling like of losing their position. They made you feel like you can lose your job if you even discuss that there's inadequate supplies or we're working with equipment that's been discontinued.
Mhm.
It's just unheard of. But we write emails, we send it to administration, we do all that. But how can you have a discontinued equipment when these companies come as like, we could always easily change it for you, but it's again a budget issue. So they give you that fear, then you could lose your job. So that's the feeling across the board.
Yeah, Nurse T, this is Mary Turner. That was where it was an advantage, me being president of Minnesota Nurses Association. I at least got to fight some of those fights. I mean, I've been literally on the local news the whole year. And, some of those stories were our county hospital that were being given N95s from 2002.
Oh my God.
And that became a story. And so that did give me some satisfaction that I could, because unlike anyone else, I had the title that could protect me. You know what I mean? Because you're absolutely right. If you're just the regular staff nurse or whatever, and you don't have a title that can, because I would always say president of Minnesota Nurses Association. So I am thankful that I've been able to do some of that fighting in the media, because you're absolutely right. None of you have that chance. You just don't.
So Claire Martin has a comment or a question and has raised her mechanical hand to let us know. Please.
Hello, everybody. I am so glad that I joined the discussion tonight. Nurse T, your book was awesome and incredibly relatable. I'm not a nurse, but I am a union member for my home care job. And we have had so many struggles trying to get PPE and just even trying to get people just to listen to us. I'm part of a board that speaks to representatives of the state on our issues regarding PPE and hazard pay and healthcare, and we don't get any benefits. So we struggled, again, like you were saying, just to feel safe. And the way you spoke about like the stress and just, that dread, that feeling of dread, I mean, it really spoke to me. It was very on point, because Tim helped me write a story about my experience. I ended up in the hospital for mental health reasons. And it was because of the stress of COVID. I have pre-existing conditions that were, manageable, but then COVID hit, and it's like, well, yeah, everything you had before that you thought you had under control, but you're kind of on the edge there. Well, COVID comes in and it just crashes into you and then makes everything worse. And so, I wrote about that experience. Tim was very helpful in encouraging me and helping me write it, because it was very difficult, but it was also cathartic, and it made me feel, like, okay, I have this on the page now, and I can move on from this, and I can, try to rebuild and try to face all these struggles just that COVID brought. My client too, we were very, very concerned that she would get COVID and fall ill because we had a lack of PPE and all kinds of things. And I was scared of losing her because she's like family to me. Yeah, so it was just a whole lot. And with your book, especially at the end where they had all those strategies for helping you to calm down and things like that. I thought that was incredibly helpful. And I just think that people who read the book will really benefit from that, and will benefit from your stories and just picturing what it's really like, because I think that we're all still kind of invisible. So I'm sorry that was long-winded, but I enjoyed the book thoroughly, and it's very poignant, and thank you all for listening.
Thank you, Claire. If you
Thank you.
send us your article or a link to your article, we would love to post it on the Eastside Freedom Library Facebook page so that people in our community will read it also. So between you and Tim, please send us your piece. And Tim, you wanted to also add something to Claire's story?
Yeah, Claire, I just wanted to say that I cried when I read your story. It is a beautiful piece of writing. I loved reading it and helping you, revise it a little bit. And you might tell them how 1199 New England provided writing workshops for their members about COVID. And it was very helpful for many of them to be able to write their story. And now, hopefully, I hope they're giving them to legislators and other people so they can hear what you went through.
Yeah, absolutely. And I'm also trying to get it into my local library. They said that they would accept it and hopefully, feature it so that people will be drawn to the stories. I think it's so important. We're the people on the ground, and those stories need to be shared. And Tim really, he gave us a great way to do that. And I think it was cathartic, not just for me, but for everybody. We all enjoyed it. Thank you, Tim.
I find it inspiring to think about how doing the one thing of writing both provides healing for the person who's doing it and can have an impact on public policy. That there isn't like you need to write a policy statement and you need to write a memoir. You write one story and it has all of those potential impacts if we can get it into people's hands. So it's a great reason to encourage writing. Renee, please.
There's two things that have popped up. When Mary had mentioned that, I speak because I know that you can't speak up. And that really resonated. I wrote, when I had to step back from the Freedom Library because our jobs started to get to be 8, 9, 10 hours, started to be working on weekends because you're fighting that invisible enemy somewhere. You don't know how to fight it, but you know that your grandpas and grandmas are really sick and the hospitals had sent them back at some point. And I wrote down the thoughts and the experiences that I was having in this magnificent, majestic rant to Peter and Beth, because I needed somewhere to get it out that wasn't just my family. And it landed on good ears. And then you did say, can we post this? But at the time, I didn't have that feeling of, if I say what's really going on, or if I share how I feel about what I'm seeing and what I'm experiencing here with all of this, and that I know it's not right, I'm going to lose my job. And I can't do that right now because my daughter takes immunosuppressive drugs every 6 weeks. And this is not good. I need to stay quiet. I need to stay under the radar. But boy, it really felt good to write it at the time. And even now, after all of what we've experienced, there is still that little piece of, I don't know if it's survivor guilt or if it's a little bit of shame or what it is, but there is this hesitancy to still talk about it. Or maybe it's just the inability to process emotions, but that's there. And that's why I'm so thankful that Mary is there. And it sounds like you're doing a heck of a job too, Mary. Thank you. And thank you, Nurse T, for putting to words for us.
Thank you.
Sarah, could I slot in just a reply to that?
Totally.
Before?
Mary, go right ahead.
And here was there was some frustration in the sense that at the beginning. especially last, like the beginning months. I felt like I was a lone soldier in letting people know. There was one news story that I literally, because people were like, well, we've got plenty of PPE now. And I had to literally, in that news story, and the reporter did a great job, I had to explain, the doc will appreciate this, and Mary T, how many people it took to turn somebody onto their prone position, because that was the only way they're going to breathe, and how that took 7 people. So that took 7 pairs of gloves, 7 gowns, 7 masks, 7, you know what I mean, for one moment in time to demonstrate. And it was so frustrating because here in Minnesota, the hospitals did not jump in and start to tell the story till like the following October or November. Reporters would plead with me, can you just take photos? Yeah, that's the fastest way for me to get fired. You know what I mean? And they were no help. And I truly believe that if they would have told the story at the very beginning, people would have believed. But they didn't do that.
Yeah.
And I would often say, is anyone listening to me? Is anyone listening to me? But I just kept plugging away, but they could have done a better job.
Thank you. Sarah Lake?
Absolutely.
So a couple of things that came up. I just did a quick check. There's a book that my partner read, who's a lot more level-headed than I am. Having had my union background, I just, had to turn into a fighter or give up. And but this woman, Sherry Fink, who's an MD, and she wrote an incredible book called 5 Days at Memorial: Life and Death in a Storm-Ravaged Hospital. And let me tell you, those corporations just sold. And, we know the story at the end. Very professional people were using euthanasia in the absolute best sense of, as opposed to, Nurse T talks about smelling the rotten bodies. It's like, it was bad. It was beyond. And decisions were made that led absolutely to no other point than, they didn't want to spend a dime. The story, Helen slogged through it and, great, like, whoa, I got about 20 page in and I can't even tell you what was happening to my heart rate and blood pressure. But, the point is that we don't have a public health system in this country, and I came from Canada, I was born in the States, raised in Canada. And we do have a public health system. Now, the flip side is, they did a great job with contact tracing and testing and PPE, and now they have no vaccines because they're not in bed with the pharmaceuticals, so there's the end of the story. Not so great. We just had to fast forward to get to the vaccines. Unfortunately, almost 600,000 dead people later. But, national nurses, again, I'm just going to do a call out, hospitals chose to not prepare for this. Concretely, we knew what was happening in China. And the second thing is, and read this Sherry Fink, it's like, there is no disaster or emergency preparedness in the American hospital systems. Why? Because it costs money. It's so simple. And people will always be expendable, whether they're soldiers or nurses or housekeepers, anybody other than, Elon Musk, Mr. Gazillionaire, I'm not picking on him. I'm just saying, we all know the rules here, and it's so painful as a provider, which is why Mary cries all the time. It's like, it's, of course, we're ripped apart, and then as a nurse to go in there and put on that emotional armor so that we're not crying all day long and bear up under the bullshit of the employer, in a country where, human rights doesn't apply to unions. We're not going to have unions. We'll kill people. We'll kill people rather than have a union. That is the history of America. And I hate to be, so whipped up, but I am whipped up. That's why I'm on the board of the Eastside Freedom Library, because some little radical lefty organization that's trying to make a difference, and thank God for Nurse T and Tim, write it down. Who cares if it's cute? Yeah, you got to be anonymous. That's not great, but We're going to battle every day, people.
Thank you, Sarah. I wonder,
you.
Mary, in the conversations that you're part of going on in the highest echelons of the government, we're having a conversation nationally now about what is infrastructure. Is infrastructure more than highways and bridges? Are people in that circle, Mary, making the case that healthcare is part of infrastructure and that some of this money that President Biden wants to get into the pipeline could come and be able to do some of the things that some of you are talking about being needed tonight?
Right. So there's 4 subcommittees, and I'm on 2 of them. I am on healthcare access and quality. And then the other one is structural drivers and xenophobia. And then there's a data and research one, which I was like, oh, that's a yawner. And then the other one is communication. But the structural drivers, that's where we address, okay, so something so simple as transportation, how that creates unequitable situations for people. So in that sense, that's where we hit the homelessness, the transportation system that's not adequate, et cetera, is in those structural drivers, the food deserts, the hospital, and the one thing that I'm starting to try to beat the drum on is how, because here, as you guys know, in St. Paul, Bethesda, and St. Joe's about to close. And where are they closing them? Right down there where, oh, gee, what's right across the street? Catholic Charities. Catholic Charity to the homeless, and so not only inner city closing their hospitals and clinics, but the rural America, where town after town. So anyway, this is where we do talk about this. Now, there's some hope, and that hope is President Biden. Tomorrow, we are going to proudly say, and you think this is easy to say and to get across to people, that healthcare is a human right. I can't tell you how much resistance there is to that, but he said it last night. So now that's going to give us courage tomorrow to say it. But I have to just close with one little thing. So we have little Vincent is our 18-year-old from Florida who's on there. He represents the youth. And I told my other fellow people, and when we're talking about healthcare as a human right for the first time and getting pushback from different people, when Vincent mentioned it, I pointed out, I said, when Vincent mentioned healthcare as a human right, guys, he's the future. It's his future that we're building here. And when he said healthcare is a human right, I saw in his face and his voice, well, of course. I said to the rest of us on this call are on our way out here. And of course they're like, well, is that a clinical assessment? I said, no, my point being that in Vincent's world and in the world of the young, of course, it's a human right. It's a no-brainer. But you cannot believe the forces of evil, and I say evil, that are fighting against such a basic concept. And because if you declare that, then everybody needs to get health care. You get it? And that's where that's why they don't want those words mentioned. That's why they don't want airborne mentioned. Right, Nurse T? Am I right?
Absolutely right. You're absolutely right.
I don't want to mention the words because words have power, Timothy, right? Yeah. So it's very interesting. And I feel like I'm in the right place at the right time. I'm very grateful for what our next month is going to be. Personal protective equipment. No. It's going to be hitting more on those structural drivers and discrimination and getting into the xenophobia. And then the next month after that is going to be personal protective equipment. You know what I mean? So we have the first was vaccine hesitancy and all of our recommendations, they're called interim recommendations right now. and we were concerned. It's like, well, are we going to wait till the end? No, President Biden gets these as we come up with them. So, yeah, it's, I feel very grateful to be on that. And I'm the only frontline worker
Wow.
on there. I'm the only frontline worker.
Well, I'm glad you're there, Mary. Let me do, Najaha wants to jump in, please.
Yeah, thank you. Mary, I think you hit the nail on the head. With what you're working on with the task force. I just wanted to point out that I think transportation especially is important with respect to the structural inequities, especially in the Twin Cities. And I will say that one of the reasons why I joined the St. Joseph's Hospital Family Medicine Residency Program is for that specific reason, that they have shut down the hospital and moved the hospital to Woodbury, where very few of the patients have access to right now. And I'm looking forward to working with the legislature and also with many providers and stakeholders to provide the structure that's necessary for those patients to have access, and that's transportation. And so I just wanted to say, I look forward to collaborating with you all who are so passionate about this topic, and look forward to working together to make healthcare a reality for all of our patients. And with that, I do have to step out to break my fast, as I've been fasting for the month of Ramadan. And I just want to say thank you so much for writing this work that's so important and timely. And thank you all for such insightful discussions. And hopefully we can touch base again.
Thank you, Najaha.
Thank you. Thank
Be
you.
well. Thank you. So, Nurse T, we're about at the end of our time. Would you like to make any sort of closing remarks?
I just want to thank everyone. Everything everyone has mentioned has really touched me, and knowing that we all speak the same language and the same experience. And I'm really, really thankful to be able to speak in this forum. Thank you so much, all of you.
Thank you. Thank you for writing the book to make it possible for us to have this conversation tonight. And hopefully more people will be reading the book and having similar conversations.
Tim.
So I want to thank you all for joining us. I especially want to thank Carla for her work making the technology work. There will be an easily accessible video on our YouTube page soon, so that Mary, if you want to share it with your fellow task force members, or any of you want to share it with your children, grandchildren, neighbors, we will have the video ready for you to do that with. So thank you all very, very much. It's been a while since I've seen some of you, and it's great to see you. Tim, thank you so much for your work. So valuable, so important. Thank you.
Thank you, Peter.
All right. Good night, all. Take good care of yourselves. We'll see
Good night.
you.